Hi YouTubers, it's Smoking SE 77 again for the second video today. So you see the video on can you talk about a pipe and cigar in your mouth? And that video will be uploaded shortly. So this video is going to be on a very odd subject and you may or may not like it. So as I always say, if you don't like the video, don't watch the video. This is going to be on something that's been on my mind for a very long time, and I mean a pretty long time. I want to discuss in this video is kind of a health-related subject, so if you don't like health-related subjects, you don't like this video, please don't watch this video. Please, no nasty comments. So this is going to be on something called HPV and tobacco. So, first off, I'm not sure if everyone knows what this is, but I want to discuss briefly in this video. This is a health-related topic. Right off the bat, I'll tell you right off the bat, this is a health-related topic. So if you're not into watching health-related topics, click off right now. So, HPV and tobacco. Now, HPV stands for human papillomavirus. And it's a virus, and PipeFriend did a video on this a long time ago. About 3.5 years ago. He actually made this video. It was called The Leading Cause of Oral Cancer. You won't believe it when you hear it, or something like that. And what HPV is it's and this is a little bit of an adult topic, so if you, well, I hope most of my viewers are adults, you know, because pipe and cigar smoking is for adults. This is a little bit of a off-color topic, or a suggestive topic, so if you're not 18 or older, I wouldn't watch this. HPV stands for human papillomavirus. It's a sexually transmitted virus, and it's transmitted through sexual contact. How does that have anything to do with tobacco? And the way it has to do with tobacco is, obviously pipe smoking is not healthy. You are definitely increasing your risk of health-related problems by tobacco, more specifically with pipes and cigars, oral cancer. But what's interesting is, I guess talked to somebody last night about this, is the vast majority of people who develop oral cancer from tobacco use, from what's called chronic irritation from the pipe and cigar smoking, or from heavy alcohol consumption, which are the two main leading causes of oral cancer, are older than 50 when they develop it. What's interesting is, and this is how this HPV plays in, is most people who are younger than 50 who develop oral cancer, a lot of people that don't even know this, develop it from HPV. So it's kind of like a reassurance to people. So people who are like, you know, really scared about pipe smoking, you know, I'm really scared I'm going to get like mouth cancer. Rest assured that if you're going to get a mouth cancer when you're younger than 50 years old, you're more likely to get it from HPV, specifically HPV 16, which is obviously not a doctor, so this is not medical advice. But what's interesting is most people who get oral cancer, specifically tongue-based and tonsil cancers, from when they're younger than 50 years old, get it from HPV, which is transmitted through oral genital contact, which is oral sex. While people who are 50 years or older get it from pipe smoking, cigar smoking, smoking in general, or alcohol use, or other forms of chronic irritation like chewing tobacco, or what's called pan or betel-nut chewing, which people do in India and Southeast Asia. So, and a lot of people don't realize that Southeast Asia has the highest risk of mouth cancer in the world. That's a different topic. So it's interesting, and this is something to put people's minds at ease. You know, I get so many messages, or I get a lot of messages, or I get some messages, people saying, I'm so worried, you know, I'm smoking a pipe, you know, I'm so scared that I'm going to get like lip, mouth, gum cancer, you know, throat cancer from smoking a pipe. What's interesting is most people who are younger than 50 years old get it from HPV from oral genital contact, which is oral sex, while most people who are 50 or older get it from tobacco use or alcohol use or other forms of chronic irritation. So that's just something to put your mind at ease. So the next time you're really worried about when you're really worried about like, oh my god, I'm gonna get like mouth cancer, I'm gonna get like throat cancer from smoking a pipe, just keep in mind that most people who have throat cancer or mouth cancer from pipe smoking are older than 55 years old when they first get it. And if you're going to get something when you're younger, you're more likely to get it from sexual activity, from having unprotected oral sex, or from having multiple sexual partners when you're younger. So anyway, that's pretty interesting that most people are much, much older when they get, I mean, there's always exceptions, but it's very interesting that the tobacco users who get, and the alcohol users who get mouth and throat cancer are older than 55, while people who get like mouth and throat cancer when they're younger than 55 or younger than 50 years old are getting it from HPV type 16, which causes cervical cancer and anal cancer, so, and also vaginal cancer. So it's an interesting topic, and it's something I want to branch out more, and I might talk about it more in the future, because a lot of people are very unaware of this. So a lot of people say, well, like, all oral cancer is caused by smoking. All oral cancer is caused by tobacco use and alcohol use. It's actually a huge percentage of, up to 80% of newly diagnosed throat cancers are due to HPV type 16, which is the leading cause of cervical cancer and also all other types of cancer. So just something to think about. So something to put your minds at ease. And I will stop doing health-related topics for a while, because I know a lot of you don't like health-related topics. Anyway, comment, subscribe if you want to, and bye.